right, where's Maci Gilliam? This is the third time this week that she's late.
I haven't heard from her.
I didn't get a text from her.
Well, what are we going to be covering today? Are we going to do the diaphragmatic convergence?
Actually, it's called Diaphragmatic Excursion. And yes, that's what we're going to be doing today.
And I heard we get to palpate the femoral pulse for this. Is that true?
We're not palpating the femoral pulse for this. I don't know where you guys get off saying femoral, but it's femoral.
I'm so sorry I'm late. Washington traffic, you would not believe.
Well, thank you for joining us so late in the game. Why don't you show us how to do proper technique of diaphragmatic excursion?
Me?
Yes, you. Come on. All right, so Miss Gillian, show me how to do diaphragmatic excursion.
Okay. So I would want to start here.
What level
No,
do you start at?
I mean here.
All right, find your T10. How do you find your T10?
Well, I want to start.
All right, so you're gonna percuss and you're gonna note sound change, and it's gonna be approximately at the T10 level. So the sound,
T10.
Yes, sound is gonna go from
T what?
resonant to dull. T10.
T10. Okay. So just take a deep breath in and hold it for me. Okay. Oh, yeah. Oh. Okay, you can breathe now. Okay, so right there, even with the, yeah, okay. Now let all your breath out and then hold that out. Yeah, or whatever. So. Okay. And
Here, Maci, use this. It has a ruler on it.
okay. Okay, so it was right here. So 1 1/4 a swab.
Okay, that technique was way off. I mean, just way off. Your percussion was all wrong. You didn't measure it correctly. When you asked the patient to inhale, you went up instead of down. And I really think you need to go back and read Bates and keep practicing, because that was just all wrong.
There's no way I'm gonna get it. It's too much. I mean, this is the hardest thing. Like, why do we even have to know this? Who cares about diaphragm?
Maci, it might help if you were actually on the right page.
Okay. Now, who cares? This is stupid. Who would ever know this?
You know, Maci, don't worry about it. You're gonna get it. Trust me.
I think I need a nap.
Okay, so today we're going to talk about diaphragmatic excursion. Diaphragmatic excursion is basically the movement of the diaphragm upon respiration. So normally the reference range is around 5 to 6 centimeters, but it can be 7 to 8 in well-trained athletes. So, what is the proper technique for diaphragmatic excursion? Well, normally the diaphragm rests around the T10 level, so you want to percuss and find your T10 level and mark it. And that's a normal respiration. Then you ask the patient to inhale and hold it. What happens to the diaphragm when a patient inhales?
It goes up?
No. Actually, the diaphragm goes down, because as you inhale, you're expanding your thoracic cavity and your diaphragm goes down. So what you want to do is you ask your patient to inhale, hold it. From your T10 level, you start percussing bilaterally until the sound goes from resonant to dull, and then you mark it. So then you ask your patient to exhale and hold it. What happens to the diaphragm when the patient exhales?
It goes up this time.
Good job. So what you want to do is from your T10 level, then you start percussing upwards bilaterally, and you mark it. Then you want to measure the level, and it should be between 5 to 6 centimeters normally. What are some abnormal findings of diaphragmatic excursion? Abnormal findings include pneumonia, pneumothorax, emphysema, tumor, and even pregnancy. So now that you know what it is, who wants to demonstrate proper technique? All right, guys, let's get started today. Who would like to show me proper technique for a diaphragmatic excursion? Who wants to start?
I'll do it, Professor Dutch.
All right, well, let's see it. All right, ready when you are.
Okay, so now I'm going to perform diaphragmatic excursion. Sir, I'm just going to expose your back just a little bit. I'm going to measure how much your diaphragm moves when you inhale versus exhale.
Okay, go ahead.
Do you mind if I write on you eventually?
No, not at all.
Okay. So Bates says that the diaphragm is usually at the resting diaphragm at T10. So right now I'm just going to start at C7 and palpate down until I feel it. I'm just counting down. Okay. Okay, so I found T10, so his diaphragm should be here. I'm just going to percuss this level to make sure it's about the right sound where your diaphragm is versus your lungs. Yep. So, yeah, oh no, don't be alarmed. That's the sound your diaphragm makes when you, can you tell the difference?
Uh-huh, I
Yeah,
heard it.
yeah, it's pretty good to hear. Now I'm just going to get you to take a deep breath in and hold it. And I'm going to measure how far down your diaphragm moves when you inhale. And actually, when you take a deep breath in and hold it, I'm going to do the same thing with you so you don't really run out of air or anything.
Okay.
I'm going to forget about you. So just whenever you're ready,
Okay.
I'm just going to percuss. Okay, I'm going to check, make sure. Okay, yeah, okay, you can breathe again.
Okay.
Because that's where your diaphragm moved. I'm going to mark it on. Okay. So your diaphragm moved a good bit. So now I'm going to get you to take a deep breath in, let it all out, and then hold your breath out as long as you can. I'm going to do this one really quickly because I know it's hard to breathe.
Okay.
It's hard not to breathe. Okay? Okay, you can breathe again. Did you hear the change? Yeah, it's pretty great. So this is how far up your diaphragm moved when you had exhaled. So right about now, I'm just going to measure it with my ruler. A normal range is usually about 5 to 6 centimeters, but it can get higher in athletes. So let's just see. Okay, and I've got 5 3/4, so you are just right. Now I'm going to do it on the other side.
Yes, now normally we would do it bilaterally, but you had such great technique. Excellent. I see you've been practicing.
Thanks.